It is a mystery of medicine as to why we still have an appendix. No matter what the studies are, no matter how much science is involved, no one can understand why after all these thousands of years we have an appendix. And one of the problems with having an appendix is something called appendicitis. This is an inflammation of the appendix, an infection of the appendix, which can be very, very dangerous if the appendix ruptures and pus spills throughout the abdominal cavity. One of the most common things that emergency room doctors see is appendicitis, and yet, for some reason, there is failure after failure to make the diagnosis timely, to intervene with antibiotics or surgery. Patients are sent home, their appendix ruptures, and they become very, very sick or even die. Thousands of young people go to emergency departments every year because the most common ages for the development of appendicitis are the years 10 to 17. And yet, so many children go to the emergency room with pain that clearly indicates that something serious is going wrong, and yet they're given a diagnosis of a virus or gastritis and are sent home. The pain often starts in the middle of the belly and then moves, or what doctors call migrates, to the right lower quadrant. And yet, because the appendix can be in different areas of the abdomen, the pain may not start in the middle of the stomach. It may start to the left, or the right, or the top, or the bottom. All things known by emergency room doctors. It is really a shame that so many patients are prematurely discharged from emergency departments without getting the care they need. If you or a loved one has been a victim of emergency department malpractice, if there's been a failure to diagnose or an untimely diagnosis of appendicitis, the medical malpractice lawyers at Simonson, Goodman, and Platzer are ready to work for you. And one thing you know, if you hire me or my firm, you can count on us.